nearly everybody has poor gut health these days. We're inundated with not sleeping well, with excess stress, with just inflammation in the gut. If anybody has abdominal bloating or constipation, if you're not pooping every day, something is wrong with your gut.
Yes.
Again, it's not as simple as just going on a GLP-1, GIP, or even Retta. We need to look at gut health.
Joining us today on the We Share podcast, nurse practitioner Christina Finnerty, an expert in longevity who helps patients achieve optimal health. Welcome to the We Share podcast. I'm Julie.
I'm Alex.
We share ourselves and we provide a platform for others to share.
We believe everyone has a purpose and a story to tell.
And we're back on the We Share podcast. I'm Julie.
I'm Alex.
What are we on? Are we on podcast 3?
We're on, number 3 with her, but this is part 2 from the last one.
Okay.
And we'll tease it up a little. She's a beautiful, smart lady. She's been here multiple times. We were talking about annuals when she was last year, and we wanted to get her in quarterly, and we did just that. So she's here for part 2 to continue. Christina Finnerty, nurse practitioner, a local longevity expert too. Before we called her a peptide pro, now she's the longevity expert. We have her in studio, and we're going to dive in, pick up where we left off, and finish today's episode with just lots of information.
Do you know one of my favorite things about you, Christina, is like you are so information driven.
Yes.
Somebody doesn't come to you and you're like, I'll figure it out for it. Like I don't know. I haven't even looked into that. You're like, well, I did a study. Let me go pull it.
Or she just is an encyclopedia. She just knows it all.
Yeah.
And most doctors are like, I'll get back to you on that. Or let me ask my PA or my nurse.
Right. Or I don't know.
Yeah.
You'll have to find that out somewhere else.
Yeah.
Yeah. And you've actually done the work. So one of my favorite things. So welcome back to the podcast. We're so glad to have you back in studio.
Thank you. I'm so excited. This is just so exciting. I love getting the word out. I love sharing information. And I'm just so excited to be here. So thank you for having me back.
Fantastic.
Absolutely.
So the first, our first podcast was a while ago. Then a few months ago, we did the second podcast. That's where we talked about our annual exam and also focused a little bit on GLP-1s. But we knew there were so many other peptides that we had not covered. So I'll just lay it out for you. You can start and tell us, bouncing off the GLP-1s, any additional information you want to give us about that, and then where do you want to go from there with additional peptides?
Yes.
Okay. Well, peptides are all the rage. As we all know, everybody is talking about peptides. And so I have people in their teens coming to me wanting to be put on peptides. I have my son's friends walking in the living room wanting to know about peptides. I even had my 16-year-old son text me one day and say, Mom, don't you do peptides? And I said, yes. And he said, okay, well, my classmate wants to know about do you do the GLP-1s? And because I said, why? She's 16. Because she has PCOS. And I said, yeah, the GLP-1s can help PCOS. So it sounds like she just needs to come see me. So that just goes to show me that everybody is on TikTok and they're on Instagram. And if you're older like we are, we're on Facebook.
Yeah. Yes. For the over 40 crew.
Generation. Yeah. We're not old. For, the Gen
For the
Z.
season.
Yes, for the season. So I really want to talk about why are peptides so popular, who has made them popular, and should we be just trusting everybody that's out there doing peptides? And so I think one of the first things that I want to say, and I did say this on the other podcast, but I think it bears reinforcing or resharing, is that everybody wants to be on a peptide, but the thing that's not being asked is what is the history behind why you want to be on a peptide? You want to lose weight? Okay, well, you need to have somebody that is helping you through. Are you sleeping? What are your hormones doing? What is your stress level? How are you eating? What time are you eating? Have you had blood work done? What is your family history? So this is what really scares me about this, what we call gray market, is that anybody can get peptides because you can just go online and order them yourself. The thing that scares me is where are they coming from? And so I have people say, well, yes, I'm already on peptides. And I know that they're safe because it comes with what's called a COA, a certificate of analysis. And then I'm thinking in the back of my mind, okay, well, AI can make
that,
anything.
yeah.
Like AI is so powerful right now. How do you really know if you don't have any background in anything that COA means anything? Do you actually know what's in that bottle? Is it actually a peptide? Has it actually been third-party tested? Do you know that there's not bacteria or endotoxins or heavy metals in there? So back to the whole, why do I think that peptides should really only be sought out from medical providers? Because they are medication. They're not supplements. It's not the same as going to get your B12 or your vitamin D or, your green tea extract. Like they really change body chemistry. They change the way that things work in our body. For instance, one of the ones that was just taken off the class 2 category, meaning that compounding pharmacies couldn't even get it. And if a compounding pharmacy can't get it, that means that those compounding pharmacies are FDA regulated. They have oversight of people that come in and make sure that it is what it says it is, that it has been tested for endotoxins and heavy metals, that it is compounded individually for an individual person, which means that it's also coming from a medical provider who has checked your medical history, that has gone over how you're doing things, what else is going on in your life, why might you want to build these things. So, for instance, Epitalon, that's one that everybody is kind of talking about.
I haven't heard of that one.
Mm-hmm. That one is a pituitary gland peptide. And just to go backwards, peptides are chains of amino acids. Mm-hmm. They are signaling agents within our body, and they are there. They are pulsed throughout our body to help our body do certain things. So Epitalon is something that can help improve overall quality of sleep, circadian rhythm, which is that 24-hour rhythm of the earth. But what if you have a pituitary tumor? What if you have a brain tumor? What if you already have cancer? Those are questions that need to be asked because this particular peptide can grow cancer. It could grow a pituitary tumor. So my point is we shouldn't just be jumping on something because somebody said it was really cool.
Right. Or it helped them because they have different
it might
chemistry.
not work that way for you.
Right. Yeah. So, kind of going back through what are the most popular ones that I feel like people are asking for right now? Like, have you guys heard of any that are coming to mind that you want to know about?
Retta.
Okay.
Retatrutide.
Yes.
I want to say Grutide, and I have no idea. We're making up words.
It's fine.
I feel like there should be a G
People
in there
call
because
it
there's
lots of
GL1Ps. It's like just throw a G in there.
Yeah.
So Retta and MOTS C.
MOTS C. Mm-hmm.
And then isn't there another MOTS? Is there two MOTS?
There's MOTS C, but then there's also SS31.
Okay.
So those are things that regulate the mitochondrial
and then
health.
The copper one, the
copper peptide.
Mm-hmm.
Okay, we can talk about that one.
Okay. So let's start with I don't know any of these. So let's start with the Retta one.
Okay. So Retta is super, super popular right now. Everybody wants to be on retatrutide.
Okay, why?
And
like,
the reason being is because it's new and it's shiny and everybody's talking about it. And that's what Instagram and TikTok does is if some influencer or some gym bro or some, just even a medical professional, there's lots of medical professionals talking about it. But my issue with it is Retta is not available through an FDA overseen compounding pharmacy. All of it is gray market. So what does gray market mean? Gray market means for research only. It is in phase 2, actually phase 3 clinical trials right now. So what that means is that it will be a pharmaceutical that is released within the next year or two because the FDA and the pharmaceutical companies, Eli Lilly, who also makes Mounjaro and Zepbound, is paying billions of dollars to get this medication out on the market because it is GLP-1, GIP, and what's called glucagon. So it's 3 peptides. semaglutide is GLP-1, tirzepatide is GLP-1 GIP, Retta has an extra peptide called glucagon. And it works really well for burning fat, for increasing metabolism, so an exercise mimetic, which people hear of that and they're like, sweet, I don't have to exercise, I can eat whatever I want, I can do whatever I want, and I'm going to lose fat. And that's what a lot of people are doing. But my concern is, and people ask me for it every day, I will not give a peptide out unless I can get it from a 503A compounding pharmacy. And what that means is it is overseen by the FDA, making sure that they're coming in and that it is a clean drug medication, that it is tested to make sure that there aren't heavy metals, things like that. So everybody is hopping on the Retta bandwagon because it does work even just a little bit better than tirzepatide, and everybody wants the latest and the greatest. But the problem is I really caution, I put that word of caution out to everybody that you really need to know where you're getting these things from and be extra cautious. And the other thing is don't just go on these things, because if you're not sleeping, then it's like you're putting a Band-Aid over something. You've got to do all of the other things that will make this last. Anybody can go on.
You mentioned that in the last podcast, and I loved how you said it. Master the basics.
You got to master the basics, because if you're not, you're going to lose all this weight. And if you're not lifting weights, you're going to lose all your muscle. And then the minute that you don't have that medication because it's banned again or something happens, then,
or you run out of money.
Or you run out of money, then you're going to gain all the weight back because you haven't changed the foundation. And you're probably putting yourself at risk for osteoporosis because you've lost all your muscle. So I really just want people to think just more about what does it mean to be on these things, because we're really interfering with body chemistry if we're not looking at the whole big picture. So I do caution people from being on Retta yet.
So you you won't do that one because you can't, because it's gray. Now, I remember learning about glucagon. And so is that something you could just take?
So that's the interesting part, is the reason that the compounding pharmacies can't make Retta is that the FDA comes in and they put certain things on this category 2 list of peptides or small molecules that compounding pharmacies can't get their hands on, so therefore they can't make it.
Right.
And so glucagon is not something that you can get on its own. It is naturally produced by the liver.
Yeah, that's what I was going to say. I'm going back to chemistry in my brain, and I'm picturing these little diagrams with here's the glucagon, here's the glucose, and here's...
Glucagon downregulates how much glucose is released from the liver, and it also helps with insulin sensitivity.
Okay.
And so added into the GLP-1 GIP, yes, our body already naturally makes it. That's what makes it a peptide.
Right.
But it's banned from the pharmacies being able to get it, so they can't make it. So I would caution people from being on Retta. Now, if somebody is just absolutely sure they're getting it from a good pharmacy and there's a certificate of analysis and they know how to do the dosing, I don't know how people are trustworthy, although they are really trustworthy of anybody these days. I mean, people even get like pre-filled syringes, even from doctors' offices, of whatever this medication is, and trust that that's what's in the syringe.
I know. It could just be saline.
What? Like, who do you know drew that up? How do you know what's in it? Like, you're just going to trust that someone's going to hand you a baggie of syringes with medication in it? So
that is a little terrifying.
It's interesting. But we live in a society that is so instant gratification that we don't care.
True.
We just want to look good. We want to, quote unquote, feel good. And we don't want to have to do the work to get there. So I'm going to go through the drive-through and get a hamburger because I don't want to go home and cook. And I don't care about the consequences of the fact that I'm just eating a whole bunch of seed oils. Now, do I have a hamburger? Yes. I'm not perfect. I'm not saying nobody eats hamburgers.
I go to Culver's at least once a week for the kids' meal.
But we do need to stop and pause about why are we wanting to put these in our body, and why do teenagers and or people in their 20s want these things. I have them coming up to me all the time.
So that's what I was just going to ask you is I think that some people believe that GLP-1s are being used by people who are 70 pounds overweight or 80 pounds overweight. Are you having a lot of people ask you for GLP-1s for weight loss when they're maybe 7 or 8 pounds overweight?
I wouldn't say a lot, but I do. And I'm not opposed to somebody idealizing their health. And if
Like
that
if it's going
GLP-1
to make them just that extra,
yes, if they can,
but they're doing the basics.
if they can prove to me that, or share with me that they're sleeping good, they're going to the gym, they're lifting weights, they're eating clean, and they just need that little extra boost to get that little bit of extra visceral fat off. Or they have an autoimmune condition where they have high inflammatory levels. And we know that that class of medication works really well as an anti-inflammatory. So I do have people that are at their ideal weight that I will support being on this class of medication, because I'm not just looking at your body mass index. I'm not just looking at your hemoglobin A1C. I'm looking at, let's look at the whole big picture. You need to go get body composition scans and prove to me that you're not losing muscle. You need to check in every 12 weeks with me. And so it's not that people that only need to lose 10 pounds can't be on these medications, but it's that those people should be doing it from a healthy standpoint and need to tell me why and how long are we going to do it and what does it look long term.
Make goals.
Well, and
have a
we
long-term
did cover
plan.
this before, like how there was that you put them on 2.5, then 5.0, and you dial it up. But that's not necessarily what everyone needs. And even just like microdosing. So working with you, like
Yeah,
to dial
because
it in.
I don't think that those higher doses, if someone is 100 pounds overweight or 150 or 75 or even 50, they might need to be on a little higher doses. But
Well, there's clearly something else going on.
Something
If
else is
someone's
going on.
that overweight, there's something else going on.
yeah,
So
it's
they
not
gotta
just that they're
fix-
eating too much or that they're not eating enough. It's what does their gut health look like? What types of food are they putting into that microbiome? That's a huge thing. So one of the peptides that I love and that I do put a lot of people on, and it did just recently come off the list, so now compounding pharmacies can get it, is BPC 157. That is one of my favorite compounds. It stands for Body Protective Complex 157. That peptide is naturally made by our gut, so our stomach and our intestines, and it is an immense anti-inflammatory, so it works great. It heals the gut lining. So I would say nearly everybody has poor gut health these days. We're inundated with not sleeping well, with excess stress, with just inflammation in the gut. If anybody has abdominal bloating or constipation, if you're not pooping every day, something is wrong with your gut.
Yes, for sure.
If you have abdominal bloating, if you don't feel well after you eat certain foods, if you just feel stress in your stomach, if you have reflux, how many people do you know that are on just lifelong omeprazole or Prilosec or naproxen? That's not normal. We
Or
shouldn't
like a
have to
cocktail
be.
of a bunch of things. Most of my siblings are.
That's not normal.
No.
That means something's wrong with your gut health. And just being on those medications is a Band-Aid. And then the secondary part of that is, well, now you have iron deficiency, and now you have vitamin B12 deficiency, and now you have vitamin D deficiency, because those class of medications or even over-the-counter medications are inhibiting your body's ability to absorb your nutrients. So now you have a gut health issue, and that is the foundation to why isn't your body doing what it's supposed to do? Why can't you lose weight? So again, it's not as simple as just going on a GLP-1, GIP, or even Retta. We need to look at gut health. So I do use BPC 157 a lot. It is also one that a lot of people seek because there's a lot of information out there that it heals injuries. So it will actually go to a tendon or a ligament and it will heal that area. It can be injected into just subcutaneous tissue, so just underneath the skin. But I also love this one because it can be taken orally, and very few peptides can you swallow by mouth because they will be degraded in the stomach. This one is exactly for
Like
the
designed
stomach.
for the stomach?
Designed
And
for the
for
stomach.
me, I haven't heard any contraindications for this.
There really are not any contraindications other than nobody should take a peptide consistently forever, because even BPC 157 can create growth issues. Like if someone has cancer, they shouldn't be on BPC 157 forever. You shouldn't be on anything
So
forever.
cycle on and off.
Cycle on and off.
Okay.
Yeah. And what does that cycle mean? It means, okay, well, maybe you do it for 12 weeks and then you take a month break and then you do it for another 12 weeks. Or maybe we've healed your gut lining and I say, okay, let's do this for 1 month, 3 times a year. Let's just keep everything in alignment as you're working on idealizing sleep and exercise and deep breathing and mental health and nutrition.
Because
It's
those
not
things are
easy.
going to be so much better for you than any medication you inject.
Right.
The medication is just the little extra push
It is.
behind what you've
Yeah.
been doing.
Well, we're designed to heal ourselves, take care of ourselves.
We are.
Quite.
Yeah.
I had the question. I'm like, I may have lost it, but it ties in with this case. So, diabetes. Like, if you need insulin, you get dependent on that, right? A lot of people take that the rest of their life. Is that one of the concerns with peptides, that if we do, because our body already makes it naturally, if we biohack or we end up taking this peptide now from
Forever.
not from ourselves, not
Yeah.
creating a way to make it ourselves, then are we like, tied to
Down-regulating.
it? Yeah. And then, yeah.
Yeah, that is a concern because we need to remember that the reason these peptides, one of the reason these peptides aren't FDA approved, and that's a big discussion. Like, does it need to be FDA approved? Is the pharmaceutical companies, are they in cahoots with the FDA? Yes. However, if we take these things consistently, they are inevitably down regulating your body's ability to use what it already has. So none of these peptides should be taken full force all the time. And so everything should be done in the lowest dose possible. What are the things that you can do to help your body make it naturally? And should you be on these things forever? We don't know yet. Now, we keep going back to GLP-1 because it's just been around forever. Like, that's not a new peptide. That's not a new compound. It's over 20 years old. That class of medication came out over 20 years ago. It's just that the dosing is different now. And it went from tiny micrograms that lasted days to milligrams that last weeks. So there is a lot of research on that. But for instance, BPC 157, MOTS-C, tesamorelin, all of these things have been studied on animals. But the reason we have to be careful is that's just it, is most of this doesn't have human studies. Now, BPC 157 does.
Okay.
But I don't believe that any of this should be taken long term. It doesn't mean that you can't, go on it, come off it, take breaks, like the GLP-1. You get down to your goal weight, you're extra healthy, you're doing everything diligently, and maybe you just do a dose once a month to stay on track.
Right.
Or the BPC 157. Or one that really you have to make sure that you cycle on and off of is there are a lot of men particularly, but women also want this, is what are called the growth hormone secretagogues. Those are the precursors not the precursors. Those are the peptides that tell your brain to pulse more growth hormone. And growth hormone is what helps us to
build
make
muscle.
lean muscle. And so tons of people want to be on either tesamorelin, CJC 1295, ipamorelin, sermorelin. There's even an oral one right now called macamorelin. And in the right place, those are good. But just taken on your own and not knowing exactly why you're doing it, what you're doing it. For instance, tesamorelin, if it's not taken at the right time of day, it'll actually increase insulin resistance, which then will lead to diabetes. And it can grow cancer. It's a growth hormone secretagogue. So this is why it's so important for
you to just not be doing it.
I doubt
you need
that
to
Kevin
be under
at
the care.
gym is asking you, say, let's sit down and give me your family history. Give me your personal history. When was the last time you had your blood work done?
Yeah.
What's your fasting insulin? They're not asking that.
No.
They're making money.
Oh, yeah. It's a business for sure.
Yeah. Yeah.
I can get you a deal and then they're getting a...
And then you're getting a deal.
Yeah. Mm-hmm.
And it's that's what I was going to say. It's not multi-level marketing, but it's a lot the same. Whereas, I'm
you're making
taking
money.
this, and if I refer somebody, they reduce my cost each month. So
Yeah.
let's both get on
Mine's
it.
free because I just sent you 10 people.
Yeah.
Why did this be okay? It's like, if you really stop to think about it, it's kind of strange
It's not
to
really
me.
healthcare
No.
at that point. You've exceeded the healthcare bounds at that point.
But people don't care. And it's like, when did we get to a place where we don't care about the long-term effects, we're not even stopping to ask questions. Or sometimes they do and they don't care. Because it's like, I don't care what happens to me right now.
As long as I look good right now, I don't care what
right now. I don't care what happens to me in 20 years when I'm in a nursing home because now I have Alzheimer's and dementia.
Yeah, dementia. That's exactly what I was thinking.
I'm 150 pounds heavier than I was when I started this journey because I didn't care because I want instant gratification. And Sally on Insta told me how good it works. So I really just want to get that out there. Like, just let's ask questions.
And let's go to medical professionals and do it the right way.
Somebody who actually knows that, first off, how to pronounce them.
Right. This is true. There's so many.
Who don't even know how to pronounce them.
There are different ways of pronouncing things.
Oh, come on, Julie. I struggled with that extra G.
But I'm not asking you to diagnose.
Nor would I. I'll tell you how to work out, but you don't need to. You already do that.
Yeah.
I'm good in that area, but this area,
what I was also going to say is we're not a very good culture at moderation.
No.
We have decided that we either need to be as skinny as Ariana Grande or as buff as I don't ever want to be that buff. So I don't know who else looks that way.
Right.
But we've got these very extreme levels that people are trying to reach.
Yeah.
And the reality is our body is built to be in the middle of that.
Yeah. Well, and everybody has a different set point.
Yes.
So if somebody comes to me and I always ask, what was the last weight you were at where you were comfortable? And they'll tell me, the last weight I was comfortable at was 150 and right now I'm at 190. Okay, when did you weigh 150? In high school. Okay, well, that's fine because I weigh the same that I did in high school. So I'm not saying that's not healthy. But for some people, that's not the set point. Because in high school, I was anywhere from, 102 pounds to 140 pounds. So because I gain weight real easy. And it's real hard to lose weight. So I've struggled my whole life.
You just got such a small frame.
You both do. You're both like little
Everybody
petite.
has a different set point, though.
Yeah.
So just because you want to be 140 pounds, if that's not your set point, you're always going to be needing the next greatest, best thing to keep you there. And you're going to be on this constant roller coaster of screwing up your metabolism, which how many women do you know? We do that like our whole life. It's like the constant pursuit of what's the next thing that's just going to help me there.
I think this last 4 years for me has been the first time where I literally have stayed.
That's great.
So strict and just held my weight.
Ate well.
And strict is the key.
Well,
it is so much work.
But it's just consistent. I mean, I've always worked out, but I've been like, no, this is my eating window. And like maybe a little fudge here and there on the weekends,
and this is my sugar intake, and this is my alcohol intake, and this is my,
And that's what I reiterate in these visits. It's a lot of work. Like, I don't look the way that I do because I go to bed late and I only get 4 hours of sleep and
you take a drug.
Eat whatever I want and I don't go to the gym and I don't think about ingredients in food. Like, no, it's a lot of work. Like, I got to go to bed at a certain time. I got to wake up at a certain time. I have to make sure I go to the gym. I have to make sure that I'm cognizant over what I'm eating and what I'm drinking and when I'm doing it. But I do it because I feel good and I don't want disease. And so I think if we can really get that into people's mind, one of the things I'm thinking about that I think everybody would benefit from is there's a really, really good book right now that's out by Dr. Jason Fung. He is one of my favorite authors. He is a nephrologist, so he's a kidney doctor, and he deals with a ton of kidney disease and heart disease, people that have already got it, and by the time they see him, they're in a lot of trouble. So he's really the forefather of teaching us about intermittent fasting, low carb, healthy fat, Mediterranean diet. His newest book is called The Hunger Code.
Okay, The Hunger.
By Dr. Jason Fung, Fung. It is, I always have a new favorite book, but in the last...
Back to our intro.
This is why we love you.
We'll add this to our summer book club.
This is my favorite because he goes in, and all his books do. He wrote the Diabetes Code, the Obesity Code, the Cancer Code, Guide to Intermittent, the Complete Guide to Intermittent Fasting, and then a book called Life in the Fasting Lane. So he's a well-known author and also has a podcast and a group called The Fasting Method. Anywho, he's very smart. Very easy to listen to. And this newest book that he has goes into why do we get hungry? And why do certain people have food addictions? Why do they have so much food noise? Why do they have a hard time saying no? Why are the people that aren't hungry all the time and they're not eating enough? But what are the foundations? And he really goes into those foundations that I always talk about, into sleep, into the how does food work? How does processed food work? How do all the chemicals and the oils, how has that changed the way that our society is aging? How is insulin resistance affecting everybody? So it's a brilliant book for healthcare providers, for everybody, that I just wish that I could hand it to everybody and say, please read this book so that you have the foundation of what you need to work on to be a healthy human and live a really long time. Because that's part of what we're talking about today is, what does longevity mean? I don't want you to live forever. I want you to be healthy. So to me, it's more about health span. The newest kind of buzzword is longevity, functional medicine,
Right.
integrated medicine. Really, what's the root cause? But the goal is live a healthy life, not live
Right.
forever.
Live well.
And end up in a nursing
Yeah.
home. So what are the things that we do now, whether you're 18, 20, 30, 40, 50, 60, 70, it's always going to come back to how were we put on earth? What are we supposed to do to maintain healthy living? And how do we reverse disease? Because we can reverse disease. We can reverse insulin resistance. We can reverse type 2 diabetes.
Yep.
We can prevent cancer. Even someone that has cancer can treat it with nutrition, with sleep, with fasting. We have so much control over what our bodies can do and also what our bodies can't do. And so I really like people to know, well, where are these foundations that I can go to, as opposed to just give me the latest peptide and I'll worry
Right.
about that later.
Right.
I also think, and maybe you can correct me, and I don't know if you're seeing this or not, but I think a lot of people don't even recognize the way that they feel or understand their body. They just exist day to day.
Yeah.
They're thinking far more about the game that they're going to go to on Friday night, or the brunch I'm having with my girlfriends, or the school project I've got to do with my kid, or whatever. They aren't actually paying attention to what their body is feeling.
Yeah.
Right.
Or they
Well-
are, but they don't know what it means. I have a lot of people that come in and say, I just don't feel right.
Yeah, it's just a lack of
fatigued.
probably information and education. Because I mean, think back to high school, right? We didn't have labels and calories on everything when I don't remember that. And I was cheering and tennis, all sorts of sports. But we would often eat a big pink sugar cookie, the Granny Bees, invented in Utah. It's like 500 calories. I know that now, but we didn't know then. And then a Diet Coke. That is so
That was your nutrition.
horrible.
Yes.
That was my lunch.
Yeah.
And then you wonder why
Right.
you have
And see, I didn't
acne
do
or
lunch
things
because
happen.
my mom gave me money and I saved it to go tanning. So I wasn't taking care of
She
my
had
body.
an intermittent fasting window during
Yes.
school.
We need to teach these kids at a younger age how to care for this beautiful,
I wish it
God
was
created
taught
image that we've been given.
in elementary school and high school. I just really do.
Instead of chicken nuggets
Yeah.
and whatever,
It's
tater tots and
it's
applesauce
so bad.
is your meal and milk. It's like,
Yeah.
where's the green?
It's really sad because our generation of children, and this has been a statistic for over 20 years, so this is even an old statistic, but our generation of children won't outlive us. Because they're going to get cancer, they're going to get type 2 diabetes, they're going to get insulin resistance, they're going to get Alzheimer's, they're going to
yeah,
get...
because
the data
they
is
were
proving
eating
it
worse.
because the age went down. The expected age of
To live.
average went down this
Yeah.
last year.
Yeah,
and then there's
it's-
too much of this too, screen time.
Yeah. Regulating the brain. Yeah. And so it's like, okay, this young person comes to me. I'll give an example. I had a 17-year-old come and his mom brought him and rightly so. Like, thank you for bringing him in to see me instead of just letting him get it from Joe at the gym
Right.
because he can, or his friend on the football team. And he said, I want to be on Retta and I want tesamorelin. And so I sat down with him and I said, okay, let's really think about
Let's
this.
unpack this.
Like,
Why?
your body already makes all of these things. And so if you would Go to bed on time. What time do you go to bed? 11:30. Okay, what time do you have to be up for school? 6. You're a teenager, a growing teenager that needs at least 9 hours of sleep. For every hour that you miss of deep sleep, you are reducing your testosterone by 25%. So you want me to put you on something that's going to help you grow muscle faster because you want to be, a lot of kids now want to compete. They want to do bodybuilding. And that's natural in the bodybuilding world to just be put on all these things. That's really where peptides
Well, he got
started,
the
yeah.
names in somewhere. So
Yeah.
he's done his
all the kids are talking
he's done
about
his
it.
TikTok research.
Yeah. And I said, I'm not going to do that right now. I'm not telling you that, what I want you to recognize is let's work on sleep. Let's idealize your vitamin D because your vitamin D is 19, which means that you have lots of inflammation in your body and you are increasing your risk of cancer and you're decreasing your bones because that vitamin D should be close to 100. So that makes you anxious. It makes you irritable. You can't focus as long. You're tired. So vitamin D is huge in kids because they're not supplementing it and they're eating like crap and they're not sleeping. So we really went into sleep. Like your body heals, repairs, and regenerates in sleep. And so let's do that first. And let's get you on these supplements and come to me with what you're eating. How many times a day are you eating? What are you doing in the gym? And then we'll relook at why would you need something like this. But I won't put you on a growth hormone secretagogue because at this age, you're going to downregulate your body's own ability to do what it's supposed to do. And then you're going to have to be on something like this forever. Like the 19-year-old that gets put on testosterone because they want to be in a bodybuilding competition. That becomes addictive. They're addicted to the way that they look. It becomes a body image issue. And I don't know if that kid's going to be able to have kids because when you
will he
take
make his own?
testosterone injections, you do not make it on your own. Your body says it's already here. I don't need to make it. So how do you know that it's going to decide that it's going to pick back up? And they don't care because they're 19 and they're like, kids? Who cares about kids? Right?
It's true.
So, yeah.
There's just a lot to work through with a
There's
provider
a lot to work
that you
through.
need to.
Yeah, so I just
Also,
want people to think about
and you didn't even
complexity.
touch on his nutrition. You talked about his sleep and about the long-term effects of these drugs. What is he doing? What's he putting inside of his body? Is he adding a whole bunch of synthetic chemicals? Is he doing a ton of caffeine?
Or processed foods.
And we did talk, all about that. So he's going to be seeing me. I always do 12 weeks because I think it takes about 12 weeks for anybody to make some new habits. Come see me in 12 weeks and we'll rediscuss what's the next level of where you're at. What are the things that I can help you with to naturally boost these things so that you feel strong and lean? And do you even have the body type to be in that class of, some people just aren't made to be bodybuilders or made to be in those fitness competitions. Like,
right.
This is that extreme
Genetic.
thing I was
I'm
talking
definitely
about.
not made to be in it.
So in getting back to peptides, there's a peptide for everything. There are, GHK copper peptide is one that's
let's
super
talk about that
popular
one.
right now. GHK copper peptide, it's great. Does our body naturally make it? Yes, it does. But as we age, it starts making less. So GHKCU is one that is great for hair, skin, nails, helps build collagen. Lots of people on it because everybody's losing their hair these days for various reasons. Loss of hormones, not enough protein, not eating, starvation.
Hard water.
Yeah.
Like hard water. Stuff,
synthetics, everything. But so is GHK. GHK is one that came off the list. So it is now one that compounding pharmacies can compound. So yes, it's okay to do. I don't think you need it. I had a 20-year-old ask me for it the other day and I said, why do you want it? And because your body naturally makes this, you don't need this at your age. What you do need is all the other things that I've hammered into the ground.
Right.
And so she went around me and is getting it from someone else, which is fine, right? But GHKCU, popular. It can be used in face creams. It can be used in body lotions. It can be injectable. It can be put on the scalp. So it's a fairly safe one. But again, it's copper. You have to make sure that it's balanced with zinc because those two work in the body together. And if they're not, then you're going to have negative consequences of not having enough zinc, which can then cause inflammation and can cause more hair loss. And
How does it work if it's topical? It breaks through the lipid barrier and you can actually absorb it.
It'll increase. For instance, it's in my face cream that we have compounded, and so it's there to increase collagen. It's oftentimes paired with one of the ones that we talked about that we would talk about is called Clo. So Clo is BPC 157 and TB 500, which is a fragment of something called TB4, which is an anti-inflammatory in our body. It helps heal injuries. So lots of people are on BPC 157 and TB 500.
Do you like how they come
Wolverine.
up with like Clo? Well, yeah, what?
Wolverine.
Yeah.
Yes. Wolverine is one. And then you add in some GHK.
Does it grow hair too? Like extra hair? Like
no, do you look like I think it's called Wolverine because isn't Wolverine, doesn't he like regenerate?
Yeah.
Oh, okay.
Yeah, that's why.
So that's why it's called Wolverine.
We package that with the laser hair removal.
Hugh Jackman, I mean.
Yes. Yeah. So that one is fairly safe.
That one's good for you to prescribe though. Like it is. And then you can bundle it with laser hair removal.
Yes. Exactly. Yeah.
That's an upsell.
Let's grow it here, not on the pits or the legs.
Or the lip.
Yeah.
Or the chin.
Yeah. That's a whole nother discussion about hormones. We can have that discussion too. Yeah. What does testosterone do? So there's Clo, fairly safe. But again, make sure you're getting it from the right resources.
I've heard of Glow. Is that different than Clo?
I believe it might just be
makes you tan.
BPC 157 and GHK copper peptide.
Okay.
Melanotan 2 is the one that everybody wants because it makes you tan. Now, that is also a peptide that is working on the pineal gland in your brain. So you're messing with brain chemistry. Is it okay to do short term? Probably. Does it have other side effects? Yes. It can cause restless legs. It can cause yawning, which is so strange. But
I don't want either one of those.
Oh, sign me up for restless legs and yawning at the same time.
Right?
You're in bed at night.
But you're tan, so it doesn't matter. You're a slight shade of gray when you take too much of it, but that's a very popular one, especially amongst the youngsters, is Melanotan 2.
I'm obviously not on this TikTok corner.
Deep dive. You dive into politics every day. You know things that we don't know.
It'll all be on your phone later, so don't worry about it, Julie. You'll start getting all the people talking about it.
It also seems like so overwhelming that I look at people and go, if you can manage all of that in your brain, just don't eat crap.
Just eat good and put some tanning lotion on. And
like
or go tanning with your lunch money.
Yeah. But really, I mean, if you would stop watching these TikTok videos and actually go to bed.
Right? Yeah.
Like there's other solutions.
It's an addiction though. Like the scrolling thing. I mean, people just do it.
Yeah. Well, and it's also FOMO, fear of missing out. Like everybody else
doing it.
Everybody else is on it. I need to be on it too because look how good they look. And we're in this society of instant gratification and focused on what everybody looks like. And we're all supposed to be a certain size and a certain color.
We could just drink carrot juice if we wanted to be a little
more orange.
A little orange.
I had a whole bunch of carrots for dinner last night. I actually thought about that. I was like,
good.
Is my mouth going to be all orange now right here?
Yeah.
Like little kids get when you feed them carrots.
I actually had a patient when I worked in OBGYN and I thought she had hepatitis because the white of her eyes was actually yellow. And I did the whole workup from hepatitis before she told me that she ate a bag of carrots every day.
A bag of carrots.
Yeah.
Wow.
So
she ate them though. She didn't juice them. She actually
it was her snack.
I can't remember. She might have juiced them.
That just makes my jaw hurt.
It was a lot of
thinking
carrots.
a whole carrot.
Yeah.
But I do like carrots.
Some of the other ones, we're all talking about mitochondrial health right now. And, and I don't even think that people know what that means other than
the energy cell.
I don't know. It sounds good.
The energy thing in your cell.
It's the powerhouse of our cells. But what does that mean? And so, yes, like sometimes that's what you need to idealize before you even start some of these peptides, because our mitochondria is under a lot of stress these days. And so the mitochondria is how our body produces energy, so ATP. And so there are certain peptides that people are taking. That's what MOT-C does.
Oh, okay.
Is it goes in and increases the amount of ATP or energy that can get into your cell, therefore helping your body heal and be prepped to be able to deal with all the things that we have to deal with now, secondary to lack of sleep and all the stress and everything that our body is bombarded with. So, but that one you can only take for about a 5-week cycle, and then you should only do it 2 or 3 times a year, because if you take it consistently, you can increase the risk of cancer and grow tumors. So it's just like everything else. Too much of something is not good. And what are you doing it in combination with?
Right. Okay. So NAD.
NAD,
we want to get
that's
that one
a really,
in too.
really popular one. And I know you really wanted to know about that one last time. So NAD is something in our body that also helps to get ATP into the cell.
Okay.
So it's helping with mitochondrial health. The issue with just everybody being on NAD is that if you take NAD orally, your body's not doing anything with it. You actually need the precursor, which is NMN or NR. Is it okay to take those? Yes, it is. I know a lot of people go and get this in an IV. It's a very long and expensive IV with, quite frankly, not the funnest IV to get.
Is it the whole day long one or a week long?
It's about 4 hours.
Okay.
It's about 4 hours. It causes immense chest pressure, and it's a painful one. But for people that have addiction or chronic illness, is it the end of the world? No. But there's other things that you can do instead. Methylene blue actually skips more steps in what's called the Krebs cycle, that ability to get the energy and electron transport. It's also antiviral, anti-aging, antibacterial. Methylene blue actually also works on the serotonin and norepinephrine and dopamine receptors of the brain. So it's great for people with ADHD and anxiety and depression. So can you take NAD orally? You need to take NMN or NR, which are the precursors.
Okay.
There's this whole cycle of AMPK and all these different complex cellular things that happen within the body. So there's lots of different things, like astaxanthin is something that can get in from another way.
We need a glossary, like a Christina Finnerty glossary for everything.
So there's just so much.
That's why I said that. I mean, so much goes into this in your brain, but you won't do the simple step of going to bed.
Yeah,
Right.
sorry
Right.
I interrupted you
Weird.
though on that. Finish that sentence.
Yeah, so I don't think it's... everybody asks for NAD because they just think it's the holy grail of anti-aging. And again, go backwards and really ask yourself, are you just taking NAD because everybody else is? Or what are you looking for and why do you want to take it? And have you mastered the basics first? Because if you're taking and spending all this money on all these supplements or all these peptides, then it's not doing anything in a broken body. And no matter what, your body can't function, even if it has all of these things, if you don't have those foundations mastered. So just ask yourself.
Because NAD is available in supplement form. That doesn't need to be prescribed. Methylene blue is available in supplement form?
It is, but I wouldn't do that one in supplement form because it's actually a dye. And that dye is generally... manufactured in China. So if it isn't third-party tested and making sure that it's free of heavy metals, of endotoxins, I only suggest it from a compounding pharmacy. And luckily, right here in Idaho Falls, Idaho, Mike's Pharmacy compounds it for us. So we can get it in a safe method, but I would not get it from Amazon because it's also what they clean fish tanks with.
Yeah, see, these are the important things that people need to know. Because
So
they'll watch
do
some
not
video
mess with
and then
methylene
they'll go
blue.
to Amazon and just pick it up.
They do. Yeah. I love Amazon. I think I said this last time on the podcast. Like, I literally have an Amazon package to my day every door, my door every day.
Door. I do this all the time.
Swap it.
It
Do
means
not
your
order
brain
your
works
supplements
fast.
on Amazon. Don't do it. They're counterfeit. They're not quality. You don't know if you're taking horse manure or 3 times the amount that you're supposed to be taking. Just don't do it. And especially not things like NAD or BPC 157 or anything really, but especially not methylene blue. There is one over-the-counter company that and I'm sure there's others, but there's one that I know of, and it's called Tro Scripts. It was created by a physician. They do third-party test theirs. It's a much lower dose, but that is the only other one. It's a troche, which means it dissolves in between your teeth and your cheek, but you have a blue mouth for a real long time. But that is one that is over the counter. But again, you have to be careful with it because things like methylene blue, if you're on antidepressants, if you're on ADHD medication, if you're on things that already affect the serotonin level in the brain, you can be on too much of it and you can get serotonin syndrome. So just like everything else, like
what is serotonin syndrome?
Serotonin syndrome is when you get too much serotonin, and it will cause high blood pressure. It will cause you to shake. It will cause you to need to be hospitalized. It causes like the whole body will just kind of shut down.
Oh wow.
So you got to be careful with these things.
There's just so much added in, and you and I, like us three, were talking about this before we went on air. I just think it's so important to have a provider involved, and you talk about all the extra things you do. If you drink energy drinks, if you have a lot of caffeine, if you are on an ADHD medication or an ADD
I was going to bring up
medication.
one other thing that people are taking a lot of that's not regulated is creatine.
Yeah.
Because it's great. It is great for you.
Creatine is amazing. Yeah.
To build
But
muscle. Yeah.
you can have too much of it.
You can.
And then if you're on other drugs too, you're overloading your liver.
Yeah. And kidney.
Yeah, and my son is a perfect example of this. We had a conversation last week. He was bummed because he hasn't been sleeping good, under a lot of stress, all the things, and he's having like some breakouts. And he's like, Mom, I went and did my blood work because I wanted to get on Accutane again, and they said my liver, I can't because those levels
Interesting.
were So and I'm like, are you
That's a
taking
problem.
too much creatine? So I think he's like, twice a day. Like he's just overloading because the gym bros, it's like, you think more is better.
Ask him
It's
if it
not.
was his liver or his kidneys, because the one thing that creatine does is creatine increases what's called creatinine in our blood. And creatinine is what goes into calculating our kidney function. And so when people are on creatine, it increases it makes it look like that creatinine level is elevated, but it's a false elevation. So it lowers what appears to be your kidney function, but they just need to come off the creatine and get their blood work redone, because it can be a false.
That's what I told him. I said, just take a break from it. Have you been taking it like cycling on and off? And he's like, no, Mom, I take it twice a day. I've been doing it for a long time.
Yeah.
But plus other things. And so I'm like, you just need to like go
cleanse,
on and do a fast.
Yeah.
I'm like, do like a 3-day water fast.
Yeah.
And then go back in.
But
and
yet, and then asking him like, okay, well, why? How old is he?
28.
Yeah, like why are you breaking out?
We already did
something's
Accutane in high school, and he got cleared up. And so there's something else going
something
on.
is pushing that out, causing that. Yeah.
It was
Okay.
interesting.
Want to leave us with any parting thoughts, Christina?
Parting thoughts. Just make sure that you are doing everything that you can to take care of yourself before wanting to put something else in your body on top of it. Just really think hard. And it's not easy. It's not easy to eat good. It's not easy to exercise. It's not easy to be, to make sure that you go to bed on time. But it is the thing that's going to keep you young and prevent you from having heart attacks and strokes and high blood pressure and diabetes and pain and depression and Alzheimer's. And so just always remember, love yourself first, master those basics, learn how to eat real clean food. Don't be in such a hurry to just grab a protein bar or a protein shake. Think about eating your cottage cheese or your eggs or your avocados.
Yeah, like mindful eating, intentional.
Be mindful and be intentional about taking good care of yourself and not just looking for the next best, because there's always going to be something. But our health is getting worse and worse in the United States, and worldwide. So we really just need to think about being kind to ourselves. How do we think? Deep breathing. Because anybody can do those things, and it doesn't really cost us a lot of money. Yes, it costs a little bit more money to eat clean, but not in the long run.
Yeah.
All
Not if you just eat less.
Yep.
Yeah.
Thank you for being here.
Thank you so much.
I appreciate
Christina.
it. Thank you. It was fun.
Thanks for joining us today on the We Share podcast.
If you've loved what you've heard, please give us a 5-star rating, tell your friends, and share this show.
You can also follow us for recipes, lifestyle and fashion tips, book reviews, and more on WeSharePodcast.com.
Join our Share Squad and sign up for our newsletter there.
We would love to connect with you.
We share on TikTok, Pinterest, Facebook, and Instagram. Give us a follow.
A big goodbye squeeze and sending you all our love from Alex and Julie.
Join us next week on the We Share podcast.